What are flu antivirals, and when should they be used? Imagine catching the flu and feeling miserable for days. Now, picture a medication that can help you recover faster and lessen your symptoms. That's where flu antivirals come into play. These are prescription drugs designed specifically to fight the influenza virus. They work by stopping the virus from making copies of itself inside your body, which helps slow down the infection and can reduce how long you feel sick. The main types of flu antivirals include drugs called neuraminidase inhibitors and a newer class known as cap-dependent endonuclease inhibitors. Neuraminidase inhibitors like oseltamivir, zanamivir, and peramivir target an enzyme on the virus's surface. This enzyme helps the virus releases new particles so they can infect more cells. By blocking it, these drugs prevent the virus from spreading further. Oseltamivir, often known by its brand name Tamiflu, is approved for use in children as young as 2 weeks old and can also be used to prevent flu in people over 1 year old. Zanamivir, or Relenza, is approved for those 7 years and older but isn't recommended for people with respiratory issues like asthma. Peramivir is given through Enrollment 4 and is approved for children 6 months and older. These medications work best if started within the first 48 hours after symptoms begin. Another newer drug is baloxavir marbixil, or Xofluza. It belongs to a different class called cap-dependent endonuclease inhibitors. It blocks an enzyme needed early in the virus's replication process, stopping it from making new copies. This medication is usually given as a single oral dose and is approved for treating uncomplicated flu in children 5 years and older. It can also be used as a preventive measure if someone has been exposed to the flu within the past 48 hours. So, when should you consider using flu antivirals? They are most effective when taken early, ideally within the first 2 days of symptoms. They are especially recommended for people at higher risk of serious complications, like young children, older adults, pregnant women, and those with chronic health conditions. They can also be used after exposure to the flu to help prevent illness, particularly in vulnerable groups or if vaccination isn't possible. It's important to remember that antivirals are not a replacement for flu vaccination. Instead, they are an important tool to help manage illness when used promptly and appropriately. Always consult a healthcare professional to determine if antivirals are suitable for you, especially since side effects and contraindications vary. They will consider your health history, timing of symptoms, and current flu activity in your area. In summary, flu antivirals are targeted medications that interfere with the virus's ability to reproduce. They work best when started early in the illness or after exposure, especially in those most at risk. They complement vaccination and other preventive measures to help reduce the impact of influenza on individuals and communities. Remember, always seek medical advice for personalized treatment options and guidance.